Symptoms of osteoarthritis. It's very difficult to diagnose the disease in the beginning. Normally, a person who is on the verge of developing osteoarthritis get a sensation in the joints. It is a simple jerk or click sound comes. It may not come all the time. Occasionally it comes. Then if he's a shrewd individual who has some knowledge, he will feel there's something wrong with the joint. Normally what happens nowadays is that most of the people, educated people, have some knowledge about diseases. So self-diagnosis and self-medication has become very important. See, uneducated people are easy to treat. Educated people are also easy to treat because they understand. The previous one they won't understand. But half-educated people are very difficult to treat because they would have read from various articles, they think they know everything and they will question everything also. So they normally do self-treatment, apply some liniments and other things, and this condition can persist for a long time, sometimes 1 year or 2 years. But then the frequency of the sounds and the click sound and the friction will go on higher and higher. The second stage is pain. A stiffness develops in the region due to collapse of the cells, drying of the fluid that lubricates the joints. That is the first symptom, the beginning of osteoarthritis. It is normally at that stage they go to a physician for consultation. And when you go, you will be normal. You can walk normally or you can perform duties. So it is taken as a beginning and they prescribe some medicines, either a steroid or a non-steroid anti-inflammatory drug. You will consume for some time, you get a relapse, your pain will be relieved for some time, then you feel that you are good. Then after some time, it will come back again. You will do the same treatment, sometimes without consulting doctor, you do the same medicine, a repetition. This situation is very common on the people. And eventually the stiffness become very hard and inflammation starts, swelling starts, the condition becomes severe and you go. The whole tissues in the region can become soft. By touching you can feel it. It will be swollen. And especially in the morning you find it extremely difficult to walk. Normally it is very common that when the sunshine comes and heat comes, there will be some kind of consolation and people will walk. The loss of flexibility is an advanced stage in the development of osteoarthritis. When that comes, it can come all of a sudden. It can come slowly. Very often you find one fine morning you cannot move. You cannot move your joint. You cannot walk. You cannot sit. If you sit, you cannot stand immediately. That's a very, very serious condition. Then you go for treatment and you have to be very careful then onwards. Then the sensation of that region becomes very difficult. Some places you don't feel the sensation because of the inflammation and the tissues is due to death of the tissues taking place. Then you find it difficult to recognize whether there is internal injury or not. In some acute cases, bone splinters takes place and the nearby areas the bones started growing. That's a very complicated case. Those bones can expand And if it goes beyond a level of growth, it becomes abnormal, it can even become malignant. Then you have to do a massive surgery to remove the extra bones and straighten it. The surgery becomes very complicated. So these are some of the common symptoms normally seen at the beginning of the osteoarthritis and also the advanced stage of arthritis, which needs immediate treatment for containing the normal activities.